Hi, everyone, and thank you for joining us for this webinar on helping kids with anxiety and depression and strategies for parents and caregivers. And we are very excited to be presenting this material through ADAA, that's the Anxiety and Depression Association of America. And my name is Dr. Deborah Kissen. I am the Clinical Director of Light on Anxiety Treatment Centers in Chicago, Illinois. I would like to introduce Dr. Vivyan. And Dr. Vivyan will provide an overview of the skills used in parent-child interaction therapy, PCIT, and parent management training. She will guide parents in how these skills can be effectively used to help kids with anxiety and depression. And you'll actually learn some of these skills during the webinar. And I must say, as the mother of a 14-year-old, 13, 10, maybe my kids are a little bit older, but I will be holding on tightly to all of the wonderful nuggets of information that you'll be sharing and using them in my practice and with my family. So really excited to learn from you today. So thank you for joining us.
All right. Thank y'all for joining us again here today, and thank you, Dr. Kissen, for that introduction. My name is Dr. Erica Vivyan. I'm a licensed psychologist here in Austin, Texas, and I will be talking y'all through some strategies for helping kids and teens with anxiety and depression, specifically from the perspective of parents and caregivers. So I know that anxiety and depression have been even more prevalent among our kids and teens in the recent months. So this will be hopefully particularly helpful information for all of y'all with young kiddos and teens at home. So starting from what we know works to treat anxiety and depression, Dr. Kissen, as you know, anxiety disorders and depressive disorders have become a lot more common since the start of the COVID-19 pandemic, but particularly those that we see in childhood and adolescence. So generalized anxiety disorder, I know in my practice, I've seen a huge spike in social anxiety disorder and selective mutism when kiddos are having difficulty talking to other people outside of the family. We know what works for those anxiety disorders. The gold standard cognitive behavioral therapy works very, very well, especially when you include exposure and response prevention for the things that kiddos are most worried about. We also know that from a parenting perspective, the SPACE program, Supportive Parenting for Anxious Childhood Emotions, the work out of Dr. Leibowitz and his team works very well in supporting parents in managing those anxiety-provoking situations with their kiddos as well. And from a psychiatric perspective, usually the first line treatment is an SSRI to treat some of those anxiety symptoms. And on the depressive side, we're also seeing an increase in depressive symptoms for kids and teens more recently. That stems everywhere from major depressive disorder, where you're experiencing more than one depressive episode, or I've also seen an increase in kiddos who are experiencing that low-level depression over a longer period of time that is now called dysthymia. So same thing works for depression, cognitive behavioral therapy, often with more behavioral activation focus. So we'll talk about how that fits in with some of today's strategies. And that therapy can be either individual or groups. I know dialectical behavior therapy is often given both individually and in groups, specific to helping kiddos in a CBT framework, but with more focus on mindfulness and distress tolerance. And again, that first line medication would typically be an SSRI. So we know what works. But today we're going to be talking more about why are we focusing on parents and caregivers as critical team members in treating anxiety and depression in kids. So we also know that anxiety and depression often include that irritable, grumpy, oppositional mood, especially in generalized anxiety or for kiddos experiencing a depressive episode. And that can be really difficult for parents to manage, especially when it's changing kiddos' mood and behavior at home. We know that parent-based treatment can be as effective as individual cognitive behavioral therapy. We also know that those externalizing behaviors often get in the way of treating internalizing behaviors. And like I said, with anxiety and depression, you might see more tantrums or avoidance. So some of those things that we tend to consider as externalizing, like they might be in our minds related to ADHD or oppositional defiant disorder, they're also a major part of treating anxiety and depression. And I know from being a psychologist who works primarily with kids, teens, and adolescents, is that parents and caregivers, including all of the caregivers in a teacher's or in a child's life, are really critical to the treatment process. So they're providing transportation, even with telehealth, they're providing access to mental health services with the computer, the internet, the reminder to log on to session. Parents and caregivers are creating that mentally healthy environment at home, and often those changes at home create so much more change than whatever changes we make in the half hour of our therapy session. I always remind my families that they spend a lot more time with their kiddo than I do. And these skills are hopefully going to help spread that intervention across the whole life instead of just for that 1 or 2 sessions a week for therapy. So the first type of treatment that I like to focus on with my younger kiddos.
Just thinking of Dr. Van, your last slide, and as a parent, but also as a provider, if it were possible just to drop your kid off and have like a tune-up the way you drop your car off, it makes perfect sense that that would be desirable and effective and efficient if it were possible just to drop the kid off, leave, and have them fixed and improved. Unfortunately, it really does take the environmental aspects to create that change, but the good news is everybody also wins. So yes, it's more work because there you really do need that parental or caregiver involvement, but then the level of distress that everyone gets less distress and everyone gets more joy. So it's more work, but also more benefits.
Yeah.
And it makes sense that people might go into it thinking, oh, I wish I could just drop my kid off. That's perfectly natural that you could wish that. I want that. Doesn't make you not a good parent. It just happens to not be as effective. So
right. I know in our practice, we'll remind parents that therapy is not the dry cleaners. Like you can't just drop your kid off and then pick up a non-anxious, non-depressed kiddo. Even after a few months, that's not usually how it works. It takes a lot of behavior change on the kiddo's part, which is often what your therapist or psychologist is working on, but also on the part of the parent, which tends to be an area that I'm really focused on. And that's what we'll continue to be talking about today. So thank you for that input. So as I said, the first chunk of information that I'll be talking about today is related to parent-child interaction therapy, PCIT. I tend to use these strategies for my younger kiddos, but as you'll see, it can definitely be adapted for older children. I use these strategies on everyone in my life, from my coworkers to my partner. So they work really well. Specifically for kiddos though, the intervention is really based on reducing those externalizing behavior problems, especially those tantrums and avoidance behaviors we see in anxiety and depression. For younger kiddos, we encourage parents to spend 5 minutes a day, just one-on-one, practicing these strategies with their kiddos. For older kiddos, I would estimate from 10, 15 minutes, even up to longer, more intense activities for teenagers when you're spending time with them. These principles are really effective in managing oppositional behavior and coaching through exposure practice when you're working on anxiety treatment. And PCIT specifically, which is a very structured treatment, it has been adapted for all of these internalizing disorders like separation anxiety, selective mutism, and even preschool level depression. So it's a very adaptable set of behaviors specific for parents to learn. So I'll be going through these lovely child-directed interaction skills. They spell out the word pride.
Sorry, quick question. I know you said it can work for older adolescents, teens. Is there a specific other treatment protocol when kids age out of that to do this?
So I'll also be talking about parent management training, which is really adapted more for older kiddos, a CBT based through Kasdan, that really fits more on the teen side of things. But I will be referring back to these pride skills once we get to that content as well. So the do skills, these are the positive parenting skills that I teach, like I said, for all of my parents of younger kiddos, but also for my parents of teens and adolescents who are struggling with any behavioral or internalizing difficulties. So we'll be going through all of these do skills, starting with praise, which is my favorite. We're going to talk more about what labeled praise means. We're going to use a super therapeutic strategy called reflection, where you're going to kind of become a therapist in some ways, even as a parent. We're going to be imitating in a helpful way to increase more of that positive behavior we see from kiddos. We're going to describe all of those positive behaviors that we see. And lastly, as we think about all these strategies, we're going to focus on that enjoyment. During the child-directed interaction, or that 5 minutes, 10 minutes, an hour that you want to spend with your kiddo each day, the don't skills that we really talk about are avoiding questions, commands, and criticism. Those are actually really difficult to avoid in a communication with someone who is extremely anxious or extremely low in their mood. So we'll talk a little bit more about how to avoid those things as we get later into the parent management stuff as well. So the first and my favorite strategy that is really helpful for kiddos is labeled praise. So we're going to talk about the difference between an unlabeled praise and a labeled praise. Now, specifically, praise is anything that you say that is sufficiently positive and increases the likelihood that that behavior you're praising is going to happen again. It's really just a verbal reinforcer. So unlabeled praises that we do all the time with our kiddos are good job, nice work, thank you, you're awesome, you're so creative. Those are great things to say to your kids. Now, to make them better and more focused on what you want to see out of their therapy sessions, out of using their strategies outside of therapy, you want to say things like, oh, good job with that specific thing that they were focused on. Or if you're drawing with your younger kiddo, nice work drawing that tree, and telling them exactly what you like about it. When we're trying to increase kiddos, maybe activity planning, if they're struggling with depression, like, oh, thank you for walking the dog. You got outside, you got some sun. I'm sure that's a good boost for your mood, and the labeled praise is boosting their mood too. When you see your kiddo taking a dance break in between their homework sessions, like, oh, you're so awesome at dancing, like reminding them what they're good at. And you can also praise the things that you're really proud of as a parent. Like, I love when you use your creativity. So these sentence stems, these labeled praises, good job with, nice work with, thank you for, those are the kinds of labeled praises that I use all the time and model for the parents I'm working with in session. And I encourage them to use those labeled praises as well when kiddos are practicing their cognitive behavioral strategies and exposures and things outside of session. So that is labeled praise. We will revisit that as well. Reflecting is something that you probably hear your child's therapist or psychologist using all the time in session. So I'm going to open this up to parents as another strategy where you can reflect exactly the words that your kid or teen are using as they're talking with you. So instead of, if the kiddo is saying, oh, I'm so upset about today, instead of asking like, well, why are you so upset? You can just reflect and keep pulling more information by saying, I hear that you're upset, or I can see that you're really upset about something. Usually they'll give you more information without interrogating them with a million questions. We all know how teenagers hate that. If a kiddo is mispronouncing a word in the middle of a tough conversation, it's so much easier to say, instead of, it's not ask, you said ash, it's supposed to be ask. You can say, well, I'll ask your teacher. You can give them the right pronunciation. You can give them the vocabulary word they're looking for, instead of being that over corrective or critical person that you really don't want to be to your kiddos. Often we get kiddos who have picked up a lot more curse words recently. So instead of reflecting like, oh my gosh, stop cursing at me, that's inappropriate, you can reflect and say, wow, your words are really angry right now. You're telling me with your words that you're angry. And instead of saying things like, no, don't stop, because that negativity and criticism usually doesn't pick up anybody's mood very much, you can answer in a way that's giving the same information, but in a positive way. Like, well, not no, tomorrow is Monday, we can't go to the park. You can say, well, tomorrow's Monday, so we'll choose a different day to go to the park. You didn't have to say no, you just gave them a different option. So those types of reflections are really helpful for parents, especially as we're managing behaviors and managing those things that are getting in the way of treatment of anxiety. So that was praise and reflect. The next one is imitate. We all know how kiddos don't like to be directly imitated, especially as they get older. But if you've got a young kiddo and they're drawing or making something with you, you can say, oh, I'm gonna do mine just like yours, and really show them that what they're doing is wonderful. I do this all the time in my therapy sessions when I'm saying, oh, I'm gonna draw a picture of how I'm feeling today. But I really like the way that you depicted your mood in that moment. So I'm going to draw my person with that same face, just like you did. It's really letting the kiddo know that they're doing a great job. If kiddos are playing with you and they want to tell you a rule, because sometimes kiddos with anxiety really just want to be in charge. So you can say, oh, well, yeah, it is your turn now and it'll be my turn next. When you pick your battles and say, yeah, I can agree with my kiddo on these certain things, that can really reduce the amount of anger, irritability, frustration that's happening at home. So in that way, we can imitate and reflect what kiddos are doing. Descriptions. This is a skill where you're actually describing what your child is doing. It really helps with that self-awareness, because a lot of what we're doing when we're treating anxiety and depression is increasing a person's self-awareness into the behaviors that are occurring over and over again. So if you're hanging out with your kiddo and they're drawing something, you can say, wow, you're drawing a star. Or if a kiddo is asking you a question over and over again, this is really helpful for those reassurance seekers. Like, how am I going to get sick? Am I going to get sick? Oh, you're wondering about whether or not you're going to get sick. It's a really great way to answer the question without providing that reassurance. If a kiddo is making something, you can describe what they're making, like, oh, you're making cat ears, or you're making pizza out of your Play-Doh. And obviously, when you're spending this one-on-one time with your kiddo, especially as an opportunity to boost mood, if they're having fun, then you can reflect and describe that for them and say, wow, you're really enjoying yourself. They might not notice that they're smiling or laughing, but you can describe that to them and let them know that what you're seeing is that they're having fun. That can be a huge mood booster. And especially for kiddos with anxiety who really are struggling to try new things or talk with new people, you can say, wow, you tried a new color, you tried a new food, or you tried ordering for yourself at the restaurant. Those are all things to describe and let kiddos bring awareness to those things, especially in the middle of an exposure or a behavioral activation strategy. And our last piece of the pride skills is to really enjoy. So when you do have time with your kiddos or teens to spend one-on-one doing an activity that they enjoy, make sure when your kiddo's laughing, playing, having fun, tell them that you are enjoying it as well, and reflect that in the tone that you have, like saying, I just love spending time with you. I love laughing with you. I love walking the dog with you in the mornings. Let them know that you are enjoying that time as well. It's really easy to help spread that joy into other aspects of what you're doing if you are modeling enjoying that moment or being brave in that moment with your child. So in PCIT, the first section of the treatment is really those pride skills, and then we get into this this direct commands area. And this is something, again, that goes specifically for younger kiddos during play, or can be really helpful with older kiddos during therapy sessions, on the way to therapy sessions, on the way to other activities that they've got to get to when they're feeling too scared or too down. These strategies can be really, really helpful. So when we think about direct commands, we want them to be direct and positive. We want to give them one at a time. We want them to be very specific. Everything should be completely age appropriate. We want to be giving commands that we know the kiddos can do, like put on your shoes and get in the car might be totally appropriate for a 10-year-old, might be a little bit much for a 4-year-old. We want them to be polite and respectful. This is one that a lot of parents, when they're dealing with that irritability or low mood, it's really easy to yell across the house and say, hey, please turn off the TV, instead of walking over and saying, hey, I know that you're really enjoying your downtime right now. Please turn off the TV and come to dinner. Explain only if you need to explain what's happening with this command. You can give it before you give the command, or you can explain it after the kiddo has already obeyed. So if you're just giving a command like, hey, please put your trash in the bin, they might ask, why can't you do it? And in that moment, you can say, please put it in the bin. And then when they do, you say, I really needed that help from you. Thank you so much. And we, again, especially when we're interacting with kids and teens who are struggling emotionally with anxiety and depression, we're only using these commands when we really need to. It might be close the door to the therapy session, a command that I use very often in my practice, but not something more unnecessary like, hey, go hand me my mug from across the room, if that's something that would usually be the adult's responsibility. A lot of these strategies can make these commands more effective, especially when we're managing something like an exposure practice, which we'll see on the next page. They can also be really effective when you're setting clear expectations for a kiddo to manage their mood through their sleep schedule, their phone use, their social time, letting them know exactly what the expectations are. That can be very helpful. Like, hey, please give your friend a call. I'd love to see if y'all can get together today. That can be a direct command that you use instead of like, why don't you call so-and-so? And then it turns into a conversation about how they really don't want to go anywhere because they're feeling really down. So these are very helpful strategies for parents to use both during the session and outside.
And so I'm sure parents who might be watching this would then think, and what happens if they don't follow the direct?
That is a really, really great question. And that's actually what the next slide is about. So as we use a removal of privileges sequence, this is what I typically use in my therapy session. I'll usually have a specific consequence for failure to comply with the command. So in my therapy office, it's, hey, remember, I told you at the beginning of every session that you have the opportunity to earn your special prize. I've got a little box of toys and candies and goodies that most kiddos like. So I'll say, okay, please close the door to the session. And then I count to 5 in my head. And if they do it, I follow up this obey is actually a labeled praise. It's thank you for following my directions. Thank you for shutting the door. Now we can have a private session. If the kiddo's not able to do that, if they're so lethargic and so just sitting on the couch like, no, I refuse to, I would probably say, if you don't close the door, I'll have to help you. And that will mean you might not be able to earn that super special prize you want to earn at the end of session. Usually with that reminder, kiddos are up out of their seat and going to get it because they really want that thing. And then they have the behavioral activation of I'm up, I'm moving, I'm going to do the thing that I was asked to. Plus you get that obey again. So you get to give the labeled praise, like great job getting out of your seat, great job listening to me. Sometimes this is actually an example that I was thinking through with separation anxiety exposure. So if mom or dad is sitting outside in the hallway and I ask kiddo, okay, please close the door. They had already agreed to it and they're a little bit hesitant. You could say, okay, thank you so much for being brave if you are able to close the door. Or if you don't close the door, I'll come over and help you. And maybe that's just standing next to them or helping them to shut the door and helping them to breathe through that experience before they're able to shut the door. And then you can immediately praise and say, great job being brave. Now you have an opportunity to earn that prize. Or, hey, you didn't close the door yet, so I can come help you. Or we can take a step back and say, well, are we going to focus on closing the door? Or maybe we can leave it open one crack and see where it gets to. And then the kiddo can experience that exposure as well as the labeled praise again.
And I'm assuming when a family starts PCIT treatment, the parents would kind of have a kickoff meeting with the child, because there's probably been lots of times of kind of giving command, but not really command, some way to educate everybody. Like, does it take a while to make really clear, this is an example of a command. I need you to put on your shoes now.
Right.
How does it go?
So actually in PCIT, the first thing that we do is focus on just those pride skills, and we don't give any commands. And once parents have really mastered the praise, reflection, descriptions, then we move into that second phase where parents begin to give commands in a play setting. So usually I do it in session. So it's kind of a specific environment and kiddos are way more likely to respond. And that's when we actually explain to the kiddo, especially depending on their age, what would happen if you don't listen to mom or dad or psychologist right away. So for some kiddos, I'll say, okay, we're going to practice with my younger ones. I'll say, okay, here's my favorite stuffed animal. We're going to pretend we're telling the stuffed animal a command, And if he doesn't listen, he's got to go over here and sit in the corner, or he doesn't get his special Game Boy time on the way home from school, or he doesn't get to watch a movie after therapy today. So if he doesn't do the thing, he won't get to earn that super special privilege. But when he does participate in the session, practice, listen, practice bravery, then you get all of those special commands. So we make it very clear to the kiddos and to the parents, like, this is what's going to happen when you do listen, you get all this stuff. And when you're not listening, then you don't get all of that stuff. And I always remind parents when we talk about privileges, which I'll get further into, is that privileges are always icing on the cake. It's not the, food, love, shelter, the things the kiddos always get. It's the extra stuff, the candy, the toys, the extra screen time. So it's okay if those privileges do have to be removed.
Got it. Very helpful.
Yeah. All righty. So the last piece of PCIT that I will go over are these house rules. So sometimes house rules are really helpful for just general family expectations, especially anything that might be aggressive, destructive, unacceptable. Sometimes curse words or obscene gestures would be fit into that house rule. Sneaky or dishonest behavior, especially if kiddos are trying to sneak around parents and stay home from school or not log into their Zoom meetings or whatever. We want to set that clear house rule. So in order to do that, this is usually something that I'll pull out when parents or kiddos are saying, hey, this keeps happening to me. I keep getting in trouble for lying, or I keep getting in trouble because I'm trying to skip class. So we label that behavior and say, hey, when you don't go to class, but I find out that you didn't go, like from your counselor or from your teacher, that's lying. That's dishonest behavior. And that's not okay in our house, because our house is really big on honesty as one of our core values. So then we explain it in a positive way. So, hey, I love when you're honest with me, and I love when you're brave. So the house rule is that you're going to be honest, and when you are making it to class, you're going to tell me that you're making it to class. And if you don't make it, you're not going to tell me that you did. But if you're lying about it, that's when you will have a specific, clear consequence. For a teenager, it might be you lose your phone privilege for a certain number of days, or it might be, for a younger kiddo, it might be, okay, well, you're going to have to go spend 5 minutes on your own in your room, just by yourself. That might be their timeout spot. So having that clear, immediate consequence when you have a house rule makes it a lot easier on parents to say, hey, this behavior that we keep seeing when you're trying to sneak out or do something that's aggressive or destructive, we might have to set a house rule for that. So I'm going to tell you about it now. And the next time it happens, it's not a discussion. It's just, this is the immediate consequence, especially for behavior that keeps popping up. So these house rules can be really effective, both at home when you're managing these types of behaviors. Sometimes I'll set those house rules during a therapy session as well, especially for telehealth. Like, hey, the rule is that you stay on the camera. If you turn off the camera, you mute it, you walk away, then that's not meeting the expectation. You won't get to earn that extra screen time at the end. Sometimes I'll give kiddos a certain number of warnings if the behavior is clearly impulsive, or they're immediately trying to avoid something. You can say, hey, this is your warning. I'm going to remind you that the rule is to stay on the camera, or the rule is to use that honesty with me when we're in session, especially with mom and dad present. And then usually they're able to change their behavior and still earn that prize or that labeled praise. So like I said, PCIT has its own kind of set of rules. It's a very structured type of treatment for kiddos 2 to 7. In parent management training, the upper limit is, kids, teens, even young adults. Anybody living at home can really benefit from parent management training. So it really starts with that one-on-one time, which is why I started with PCIT. One-on-one time with a kiddo is essentially child-directed interaction, using those pride skills and avoiding questions, commands, negative talk. Praise is a big one. Specific to older kiddos, using that labeled praise in different contexts will be incredibly important, both when you're spending time one-on-one and when you're just noticing things and strategies they're using outside of those individual sessions. Actively ignoring things that are not going well, that can always be a helpful strategy to reduce that nagging behavior that older kiddos and teenagers really hate, that you can actively ignore the things that are not going well while pointing out the things that are. That's a really tough one for a lot of parents to learn, and it's so freeing when you don't have to be nagging as much as you have been. Reward systems, we'll talk a lot about those because they're very helpful in rewarding the positive behaviors when we're treating anxiety and depression. Timeout can be a helpful strategy for kiddos up to about 10, especially if it involves a timeout from something that might be continuing to reduce their mental health or their mentally healthy living. So timeout from screens or timeout from video games, those can be helpful strategies to make sure they have more time to practice bravery, to practice social connection. Making a plan for when behavior might go poorly. So a plan for the first day of school, making a plan for going out in the community, that can be really helpful. And then parent management training also really emphasizes the use of a daily report card and getting more information from the school. And that's where we kind of triangulate between the psychologist, the school, and the parent. So I'm going to be focusing on a couple of these key strategies from parent management training and how they might apply to anxiety and depression treatment. So like I said, labeled praise pops back up again for our older kiddos, going from unlabeled praise to labeled praise, specific to anxiety and depression treatment. When you're praising a kiddo for being brave on their exposure treatment, or I'm so proud of you. I think the first few therapy sessions, or even as a kiddo is getting used to talking about their feelings at home with parents and caregivers, telling them that you're really proud for telling you how they're feeling, that can really lead to more sharing of those emotions. And as always in therapy sessions, I will remind them, like, thank you for working so hard. Kiddo comes back to therapy with their exposure homework completed, or they met a new friend, like, wow, thank you for working so hard at this. I know that these are goals we set together, and I can tell they're really important to you. So using labeled praise as a positive reinforcement for older kiddos is also particularly important. Deborah, it looks like you're talking, but you're still muted.
Sorry, I was talking, forgot to unmute. Yeah, are there some that find positive reinforcement to be aversive? Not just like pretending to just like it, but actually truly find it almost punishing to have it pointed out something good about them.
Yes, I have worked with a lot of older kiddos and teens that really dislike that clear, very like overly sweet labeled praise.
Right.
And that's when I rely on both areas of positive reinforcement. So some kiddos rely really well on with labeled praise, and they enjoy that labeled praise. Sometimes it's a lot about wording and what would a kid really want to hear. So if your teenager is like, oh, well, it sounds really lame for you to say, great job with your homework, you can say, wow, that's dope, that's boss, that's amazing, like, cool, you got that done. That's a very different way of communicating with your kiddo than saying, nice job for doing this. Other kiddos just really like to have a reward or a privilege instead of that labeled praise, because the attention feels uncomfortable. So you can say, hey, like, great job. And sometimes with my kiddos, I will not necessarily make a very overt labeled praise. I'll say, nice job with that bravery, and just put a tally on the board, or just put a check next to their name because they know they're earning something, or put a sticker on their chart, whatever.
Put it out there, but don't linger too long, enough that they're hearing it, but not so much that it's becoming uncomfortable. So playing around with the language, the pace. That's actually very helpful.
Yeah, I know I work with a lot of parents who say, yeah, my kiddo just hates positive reinforcement. And usually I say, they don't hate positive reinforcement, they probably hate the attention. So giving them the positive reinforcement without attention, young kiddos tend to soak up the attention. Older adolescents and teens are like, no, I don't want all eyes on me all the time, even if it's just a therapy session of, psychologist, parent, and kiddo. So that's a really helpful question to think about. What does your kid really want from you?
Right. Helpful. Thank you.
Yeah. And the flip side then of that positive reinforcement would be rewards. So we can either increase behavior by labeling it, praising it, or we can increase that behavior by rewarding it. So the way that we reward older kiddos for all of the hard work they're doing in therapy, or their chores, their schoolwork, all of the stuff that we want them to do for their own health and well-being, we start with that list of rewards. Usually this is where I engage kiddos in, well, what do you want? What do you want to earn? What's something you've been asking for? What's on your Amazon wish list? What's on your Christmas list? Think about what your kiddo has been asking you for. And they probably have a million different things, or they might have one specific thing that they always come to you with, like, hey, can I earn extra money for this? Can I earn some extra screen time? Can you make my screen time limits shorter or longer? So make that list of rewards first, and then talk about the behaviors that you want to see more of. And this can be collaborative as well. You might have some ideas from your child's psychologist thinking through, well, what are the behaviors that I want to see more? Well, I would love for you to say hi to more friends in the hallway, or I would love for you to finish your homework before you go into your video games for the day, so that you're not feeling bad about not finishing it and stressing out at 10 at night. Think about what you want to see, and then start to make those connections. So as soon as you're done with your homework for today, then I'll unlock your phone and you've got some free time on your phone. Or as soon as you say hi to 3 people in the hallway, then you can come back to our therapy session and you can pick out 3 prizes from this box. So thinking through what exactly are the things that you want to be rewarding, and how does the kiddo want to be rewarded. Giving that reward as soon as the behavior happens is really the best plan, which is why sometimes having parents, teachers, nannies dole out those rewards or privileges, that can be really helpful. Increase the difficulty as time goes up. Maybe on the first day of school, the goal is to say hi to 1 kid, 1 friend, like just say hi to somebody. And then maybe by the 2nd month of school, you're saying, okay, I would like you to say hi. Can you get to 5 kids today and tell me their names? So as they increase that difficulty, they'll still come back to the session or come back to mom and dad and say, hey, I had an awesome day at school. I was meeting all kinds of new people and really practicing this. And then again, you want to link that labeled praise with the reward. This is where, and I'll talk about this later, we don't like to feel like we're bribing our kids, like, hey, you get extra screen time when you do this. It's really like, you finish your homework, that's how you earn your extra screen time. And I'm so proud that you already got that done. Like, look, it's 3 o'clock, got your homework done. Here's your phone, here's the Wi-Fi password, here's the Amazon gift card you earned, whatever. So think about how you can connect the behavior to the reward as close and as clearly as possible. That's why, that's how rewards work best. The most effective, and I phrase, go ahead.
Just thinking about, well, some of the main concerns I hear with families who come in is, number one, well, I don't want to bribe just for functioning, but I think you address that well,
Yeah.
that everyone, when they do a hard job, deserves some kind of.
And I do have a bribery slide later as well.
Okay, yeah, so that's sometimes a concern. And then another thing that I see is, oh, we've tried that before, but I could say as a parent, it seems so simple, but if you're not tracking it, if you're not actually giving the prize, it's so easy for reward systems to die, and then they're not going to work if you're not really giving the rewards after somebody does the behavior. So really thinking about who's tracking it, where are we documenting, like how, when it happens, because it shouldn't be that complicated, but it becomes very complicated in terms of actually keeping the reward system alive and active.
Absolutely. And I do have another slide later about how, like, the steps in creating that reward system as well, if parents want to design that themselves.
Good.
And I do hear that all the time. Like, we have tried this before and it worked for a week. And then that's where we look at, like, what else is reinforcing this behavior and what's going on. So it's really helpful to bring that to your therapist, your psychologist, and say, hey, this reward system wasn't working. And usually that's where I get to work. And I'm like, okay, how can we tweak this to make it work for the outcomes you want to see for your kiddo? One of the things that is actually helpful in the context of those positive reinforcers, so that means things that we're adding and things that are increasing the likelihood of behavior. The opposite of that would be a negative punishment. So the things that we're removing and decrease the likelihood that that behavior is going to happen. Again, some real behaviorism right here. So negative punishment for a kiddo or a teen is just actively ignoring the stuff that you don't want to happen more. As long as it's not destructive or absolutely against your family's morals or guidelines, you can actively ignore a lot of behavior and focus on the good stuff, which really helps, again, with that irritable, grumpy, anxious or depressive mood. So negative punishment, I practice this all the time. We're actively ignoring and totally removing attention from whatever's going on. So what I will actually practice doing in a therapy session is I will move my body like this when the kiddo is off in la la land or talking about something inappropriate. I'm not here to decide what is appropriate to your family or not, but if they're drawing something really inappropriate on their side of the screen, I'm just going to totally move. And usually they stop pretty quickly because they're like, hey, this person's not paying attention to me anymore. And I'll remind you that any attention is reinforcing. So positive attention when you're laughing together. Sometimes I work with a lot of parents and myself as well, where you're laughing because you're uncomfortable about something a kiddo is doing. That can actually be reinforcing what the kiddo is doing. Negative reinforcing scolding is also giving that kiddo attention, especially for our young kiddos. Any attention from an adult is probably going to increase that behavior in some way. Active ignoring means you're ignoring any behavior that's not aggressive or destructive. And when any desired behavior occurs, so even if the kiddo's like off in la la land, drawing something inappropriate, and then they come back and ask me a question, I can say, oh, that's a really good question. I really like how you're back engaged in the session. Or if kiddo is bouncing from couch to couch over and over again, and then they all of a sudden stop, you can say, wow, I love how your body looks calm and you're sitting quietly on the couch. That's how the couch is meant to be used. It kind of eliminates that need for saying, hey, stop, please don't stop over and over again. Because again, sometimes that attention is really reinforcing that behavior. This active ignoring can be really helpful, again, in the treatment of anxiety and depression during session and between sessions when you're really noticing like, hey, kiddo wasn't able to do this exposure, but they did this one. So that's when I tell parents, hey, let's focus on the stuff that went well. So which exposure were you able to do? How did it feel? How brave are you feeling right now? Actively ignoring the stuff that didn't go well allows me to focus on those areas of change that we are continuing to support. And that's what I'm modeling for parents in session. Again, with older kiddos, indirect versus direct commands can be really, really helpful. So when you are practicing exposures and instead of saying, hey, would you like to try to watch the video? If they've already decided and that's the next step on their exposure letter, you can say, press play when you're ready. Like that is their next step. Instead of saying, let's pet the dog, like we're practicing for an animal phobia, we're all gonna pet the dog together. No, please pet the dog with your hand. You've got this. This is what we decided on. Indirect commands, like oftentimes I'll bring kiddos into a session and be like, come on in. Whereas with my kiddos who are really struggling with maybe separating from parents, I can say, come, please sit next to me or please sit down on the couch. That gives them what to do instead of what not to do. And then again, you follow up with that labeled praise for compliance and give them a clear understanding of what would happen if they did not comply. So that was really an overview of PCIT, of PMT, the strategies that work really well during session, between sessions for our parents and caregivers. Some of these FAQs are things that we've touched on previously, but some of these I think could be really helpful in further explaining how we can use these strategies and probably some of the questions that might be on our audience's minds. So the first one, when we're focusing on parental treatment, this actually goes back to Dr. Kissen, what you were talking about with dropping your kiddo off at therapy and hoping that they are magically healed, or hoping that the psychologist and the kiddo does a lot of the work. And that's true. We are doing a lot of the work, and we really need parents as a key component of treatment. So the factors that influence behavior, I think about it, this is why I have a slice of pie on the slide. It's a pie. There's a responsibility pie. Kiddo has a slice, parents have a slice, nanny has a slice, teacher has a slice, psychologist also has a slice. So all of these people have a slice of the pie, and it's really important to consider all of the factors going into a kiddo's behavior. So for a child, there might be specific psychological predispositions, genetic predispositions to what's going on with their depressive or anxious symptoms. There might be also physical or developmental characteristics, maybe learning difficulties or other things that are contributing to their anxiety or to their low mood. The consequences of behavior, which is really what we're focusing on in PCIT and PMT strategies, is that you can have positive and negative consequences. That means you're adding something or you're removing something, and you can have rewards or punishments. That means you're either increasing a behavior or decreasing a behavior. Every behavior that a child has, whether it's an anxious avoidant behavior or a sad withdrawn behavior, all of those things have consequences, and we want to change those consequences to support the kiddo in what they're doing. Parents have a major level of control over those consequences, so does your psychologist or therapist, and so does the kiddo's teacher. So thinking about all of the adults that might be responsible for that chunk of the treatment is a big deal. Parents themselves have their own temperament, their own parenting style, their own physical features. I work with some parents who are really young and energetic, and some parents who are much older and who are like, wow, this takes a lot of work and chasing around this 13-year-old kid. Parenting experiences from your own parents, from your grandparents. What kind of parenting have you seen, and what are you most comfortable with? All of those things play into how you're raising your kiddos, especially when you're raising your kiddos in that mentally healthy environment. And life events in general, family stress, schedules, COVID, school closings, all of these things play into how well the kiddo is able to adapt to that environment. So none of this is actually your fault as a parent or caregiver, but it is a huge chunk of your responsibility. So you've got a big slice of the pie, as do a lot of these other factors here. This is our quick section on bribery. A lot of parents will come in and say, hey, we've done rewards before, but it feels uncomfortable. I don't want to bribe my kiddo. I've even had a parent bring up that idea of, I don't really want to just continue this cycle of consumerism where my kiddo gets something every time they do something good for themselves. And I 100% agree. So I like to make a really specific difference between what is a bribe and what is a reward. Bribe, this is the dictionary definition, but there's also legal definitions that clearly indicate that bribery is illegal. So if you're trying to persuade someone with money or other things to do something illegal, that's bribery. That's what we think of as bribery. That's why it has such a negative connotation. Whereas a reward, which is how I will always reframe this for my parents, is giving something to someone in recognition for their services, their efforts, and achievements. So exactly what you said before, Dr. Kissen, is we're rewarding kiddos for doing this work. It's a lot of work to change your brain from an anxious brain to a less anxious brain, or from a depressed brain to a brain that can experience that full gamut of emotions. So rewarding someone for that work is not just saying you get a gold star because you tried. It's saying this effort is hard and you deserve to be rewarded for that effort. A big difference between bribes and rewards is that a bribe is usually like money slipped under the table before something happens. Think if you accidentally gave your kiddo an allowance before they completed their chores, or a reward that's given after, like, hey, it's Friday, I saw that you took the trash out this week, so you got your reward. Another example that I give to parents all the time is, would you consider your paycheck a bribe? We're not paid on the front end of the work that we do. We're paid after. If we're psychologists, we're paid after we see our clients and complete our session notes. If you're going to work every day, you don't get that paycheck the first day you start. You get the paycheck 1 or 2 weeks later. And your paycheck is not a bribe. It's not telling you that you have to do this thing or else. It's just saying, hey, you did a good job. You did the job that you were expected to do, and that's why you're getting paid. Sometimes you get that bonus. We can give our kiddos bonuses as well and say, wow, that was extra special effort and you deserve this extra thing. And the cool thing about using rewards is that you can phase them out as behavior improves and they're less necessary, because we're creating habits. We're rewarding kiddos for being brave, being flexible, getting out of their rooms, talking with more people, doing things that are mentally healthy for themselves, getting outside, eating well, sleeping, all of these things we want them to continue to do. But if we make it a habit and keep rewarding them for that habit, the dopamine in their brain is actually going to help them to form a habit, and those neural pathways get stronger. So it's not just saying everything you do has to have a reward. It's saying, I'm going to train your brain to behave this way because I know it's going to be mentally healthier for you in the long run. And this is where I have families who will say, well, my kiddo did one thing, picked up their toys. I gave them a Skittle, a piece of chocolate, a tiny thing. And I'm like, that works. You're creating those neural pathways and you're making them stronger so that they continue to choose that behavior later on. That's a big one. This other question that I have been getting recently, especially I'm in Austin, a lot of our parents are like, hey, I want my kiddo to, yes, like listen to me, but not have this blind obedience to authority. That's not what we're going for. So I totally agree. I'm not asking you to always have your kiddo agree and respond to you. I want you to have more of an authoritarian style of parenting versus authoritative style of parenting. So authoritarian, that's the type of parenting that we want, is actually creating that positive relationship with kiddos. So you're providing options, you're explaining the reason behind the rules, and you're helping them to learn decision making. Sometimes that means you're giving them a choice, like, hey, do you want to shut the door completely for this exposure, or do you want to leave it a crack open? Which one do you think you are brave enough to do right now? Versus shut the door now or you won't get this thing. So working with your kiddo to make sure you're giving those choices, explaining why, instead of using phrases like my way or the highway, or because I said so, because mom said, because dad said, because grandma said, you can say, well, because it's actually really important to grandma that you tell her the truth, or it's really important to grandpa that you use kind language. Those are things that can really help kiddos to better make those decisions for themselves and choose the actions, the behaviors that fit with their own mental health and with the family's values. So this last little chunk of time, I'm looking at my clock and we've got about 10 minutes or so. We're going to practice some of these skills together. So labeled praise is something we talked about in the PCIT section as well as the PMT section. So I'm going to give some examples of situations where there's an opportunity for labeled praise here, and y'all might be able to think of what we could do to praise the child in this situation. So if kiddo client reported like, I didn't do any of the exposure practice, I didn't really try my activity planning, but I did change this one thought. I thought that I was going to be too scared to go to school on Monday after Thanksgiving break, but I went to school. That's an opportunity to use a labeled praise. So think about what you might say there to your kiddo. Another example is if the kiddo is engaging in exposure and looks visibly anxious, like really nervous and scared. Most parents do not like seeing their kiddo uncomfortable. It's not fun. It's not fun for me as a psychologist either, but it is an opportunity for labeled praise right there for evoking that feeling of anxiety, and the kiddo is remaining brave and courageous. The last example, an opportunity I'll give before I pop up some example labeled praise will be if you as a parent come in and say, well, I tried using the pride skills, but I'm really bad about asking questions. I just ask them questions the whole time. So what is an opportunity to praise there? Let's pop up. Yes. Okay. So if the kiddo says, I didn't do any of my homework, you can say, wow, well, you practiced that cognitive coping strategy. And that lets me know your brain is getting ready to engage in that exposure or in activity planning for improving your mood. So great work. And you'll notice here, I didn't say, well, next time you better do your homework. I said, nice job, because that is the work of therapy. If your kiddo is looking visibly anxious during an exposure, this works really well at home. Just wow. I'm so impressed with your bravery. I'll note to kiddos, I'll describe like, wow, your legs are shaking and you're still, closing the door. You're still touching that thing that your OCD tells you is contaminated, whatever it is. Like, wow, I am impressed with your bravery and your courage. And then if you're going into a therapy session and having to tell someone, well, I didn't use the reward system the way that we talked about, then you might even relabel that for yourself, or your therapist might relabel that and say, wow, I'm really glad you were able to try that strategy. And now we can problem solve about it. So those are ways that you can use that labeled praise to really focus on things that, are really not going the way we expected them to go, but there's things that we can praise there. Another option for y'all at home is to think about how to develop a reward system in a way that works really well. So I know Dr. Kissen mentioned that a lot of parents have tried reward systems in the past. We probably all try a reward system at some point for potty training or for eating new foods or for getting to school on time. But think about a behavior right now in your kiddo's life, in your teen's life, maybe something that has to do with their anxiety or depression. Like you would want them to be able to make it through the school day without calling or texting you, or you want them to be able to make it to their best friend's birthday party, even though that might be super overwhelming, or they might feel like they just want to stay home. So if you want to see something more often, you choose that small immediate reward. I always remind parents that my immediate go-to is the currency of the time is like, I don't know, would you like some more Robux? Would you like some more time on Minecraft? Those are things that kiddos usually find reinforcing if they have their thing that they enjoy. Maybe it's like they want to spend time watching their favorite anime. That's awesome. I want you to do that. That's good self-care too. So it's kind of like a win-win. And then you choose a longer term reward this is my key rule, and this is something that comes directly from Kasdan. About 80% compliance is good. So I will set a goal for, okay, over the next 10 days, can you get 8 days that you make it to school the whole day? That means you get 2 free passes where you can call me, I'll come pick you up, I won't ask questions. I actually won't even tell you that that was wrong. I'll just be like, oh, well, today's one of your freebie days, that's fine. And then remind you, okay, so if this is day 4, you've still got 6 more days that you can make it through school, and then we'll get to go see that new Disney movie you're so pumped about. So making it clear, doable for your kiddo. Don't expect perfection. Don't expect perfection from yourself as a parent. Don't expect perfection from your kiddo or your team. And then, as Dr. Kissen said before, decide how to keep track of progress. This is where I tend to do it on a cell phone and put it directly in notes and say, oh, well, my note says that you made 3 days to school this week. So that means you're still going to do 7 more, and then, or you're still going to do 5 more, and you're going to be able to earn that movie. Or you can put it up on the fridge. Younger kiddos especially love this. They love to see their progress out in the open. But as Dr. Kissen noted, teenagers don't like that attention all the time. So it might be, hey, I'm going to keep track of it here, or I'll send you a text message each time that you get that next thing done and say, wow, thanks for taking out the trash. +1 on your Amazon account. And then you create that if-then contract. So especially with older kiddos, you can have them help you create or design this contract and then sign it and say, if, for example, with my kiddos who are super depressed and they're not sleeping enough, if I turn in my phone by 10 p.m. each night, then I'll get to keep my phone all day and get a chance to go to the movies with my friends on Friday. So check it out and say, what is it that we want to do 80% of the time? And then what is it that you're going to earn? Making a reward system this specific starts to fill in those gaps of where reward systems tend to fall apart. It also really helps to focus on the positive behavior instead of the stuff that we have been seeing or the patterns we want to change.
And just for viewers to point out, all of these concepts sound easy enough in theory. And then, as we all know, when we try to implement, real life takes over and it gets very, very complicated to do all of these steps that make a ton of sense. And so there's getting the support through ADAs, find a provider or provider by you. You could ask your pediatrician, because they're all the things that when we're at our best and we could do all the things that make sense, maybe we could do, but having that support to hold the parents accountable, the child can go a long way too. So if you're trying out some of these concepts and it feels like it's not working, that just means a little extra help from the sidelines might be beneficial, not that you're doing anything wrong. So
absolutely. That's actually a really great point, is that most people who start a behavior system, even using these steps, are not going to have immediate success. You're not going to turn around that behavior in a week or a month. And sometimes it does take the help of a mental health professional, someone who really specializes in working with kids and teens, or working with that anxiety or depression that you're trying to help your kiddo fight. They can really help you to set up the system, and they can also help you keep track of it. So it really helps to have that additional person. If you're thinking about the pie that we had before, give someone else a piece of that pie. If it's just you and your kiddo splitting that pie, give a piece to the teacher, give a piece to your therapist, give a piece to your kid's therapist and your own therapist. Think about how you can distribute some of the responsibility for this behavioral and emotional labor, because it is not easy, and it's not meant to be easy if you're really trying to change these patterns that can be very deeply ingrained even for kiddos.
right. And if you're watching this today and you have any questions also, I know it's a lot of information. Hopefully this could be a part 1 that we could roll out a part 2 at some point. So feel free to email to ADAA and any questions that you have, and we'll, if that's okay, get them to Dr. Vivyan and try to continue to share this information, because it is so helpful. And I think these days parents deserve as much support as they can get to manage their lives and help their children. So this is great. Thank you.
Absolutely. Thank you so much for having me. These are my references. And then
yes, our timing was perfect. Okay.
So we're right up at the end. Unless you have any other questions for me, things that you're thinking about in your practice and your parenting, or things that parents ask you a lot. But we can also leave that open to our viewers and see what questions they come up with.
Yeah, I think the different challenges in terms of, I think all of the things that you said are so helpful and yet so hard to implement, such as the active ignoring and how hard parents struggle with it. Feels like they're not doing something. If a kid is being disrespectful, then it's like I'm saying it's okay if I don't punish or do something to make it clear that behavior is not okay. So to understand that you are doing something by
Yeah.
actively moving your attention. Is there some way to help relieve some of the, I guess it's guilt that I should be doing something when
Yes.
these bad behaviors happen?
Yes. And I think that's one thing that I work on with a lot of families during session is to say, hey, like I'm going to tell you outright, like I'm going to actively ignore what your kiddo is doing or saying right now because it's not helping him to get to his goals or it's not helping her to be brave in this moment. So I'm just going to turn and ignore. And this is a strategy that I, as a mental health provider, am doing. Is this always easy in my personal life? Absolutely not. But I will walk you through it. And sometimes I'll just have the parent literally bring a book to session and say, hey, kiddo's going to be feeling anxious and they're going to come to you for lots of reassurance. We've set the level of reassurance that they're okay with, but they're going to try to get more. So in that moment, you say, all right, I'm going to keep reading my book. And then I can kind of engage the kiddo and help them through whatever they're working on. So knowing that a mental health provider is saying, hey, this is a helpful strategy because the negative attention, that, hey, stop that, or the, you just said a swear word in front of a grandma, like those things are not helping you to get to where you want to go. So I am going to challenge that. And it's really uncomfortable for parents to change that behavior. So it's okay. I think reframing a lot of this as the space treatment does as well, reframing a lot of these strategies as this is exposure for parents. You're trying new things in your parenting to help your kiddo. And that can feel weird and uncomfortable, and that's okay. But that's why it's really helpful to have a mental health professional sitting right there with you and saying, hey, this is the strategy I'm using right now. See how I'm doing this in a kind, loving way. I'm not just going to like flat out ignore your kid. But doing that and showing them what it looks like can be so much easier than trying to do it on your own. Like, am I doing this right?
Right. Okay, well, I think so much great information to take in, and I imagine we're going to have lots of questions that we could continue to share information on this front. So thank you for joining us today and presenting on this topic. We really appreciate it.
Of course. Thank you so much for hosting.
And if you would like to learn more about ADAA or access tons of wonderful resources, feel free to go to the website and you'll be able to access other webinars such as this one and lots of good information on empirically supported treatment for anxiety and depression, as well as a Find a Therapist directory where if after watching this webinar, you'd like to get a little bit more support, there's wonderful providers all over the globe that you can access their information. We also have free ADAA support group online available, so we recommend checking that out as well.